Hi, my name is Alyssa Infante. This is my ID, and this is my flashcard. And can all of my audience members please wave? Thank you. Okay. Ready? Hi, my name is Alyssa Infante. I'm going to be talking to you today about the increase of mental health issues in the United States. The CDC states that 1 in every 5 Americans have some sort of mental health issue, whether that be something like depression, anxiety, anything of that sort. There are a lot of different ways that mental health affects us, and it can be seen through every portion of life, whether it's with relationships, with school, and even with yourself. There are three main causes for mental health, those being generational trauma, biological factors, and social media. Although this has changed over the past couple of years, these are the main factors that are affecting current generations right now. Generational trauma has been a huge issue um, because a lot of generations in the past have not dealt with that issue. One example would be that, let's say, a daughter gets sexually abused, it affects her mother, and then her mother would be, let's say she's getting sexually abused if it's by the father, and the father might have been sexually abused by his father. It just goes generations through generations, and since there is no real cause or way to fix it, most generations have to deal with unhealthy coping mechanisms. Duke actually did a study, and in that study, they found that the two most unhealthy coping mechanisms that people use are to demean the issue and make it seem like it never really happened in the first place, or to just completely not deal with it and pretend it didn't happen. These two unhealthy copenisms that many cultures have adapted into their generational trauma have led for it to just get increasingly worse as time goes on. Then we have biological factors. Biological factors don't have no certain cause. They are just something that you're born with. But the interesting thing about biological factors is it is something that you're born with, but it's also something that your environment around you can affect. For example, many prenatal babies who are born before their due date have some biological factors that can lead them to have depression, anxiety, or other mental health issues because they don't get enough oxygen. So their neurotransmitters don't work as well as it's supposed to. But also, like, if you're in an environment where you're dealing with a lot of drugs or substance abuse, that can also cause your neurotransmitters to not work as well. And a lot of studies have shown that can lead to depression, anxiety. It can lead to just a multitude of mental health issues, which has been a main cause, especially for this upcoming generation, where drugs and substances have become more normalized and legalized, even. So that has been a main issue. And then another issue that especially Generation Z has been dealing with is social media. Social media has been a huge problem for mental health, and although it seems like something that is easygoing and something for people to just enjoy, social media actually has a highly addictive factor, which leads to other mental health issues. Bu Zong actually did a study showing that it may not cause any mental health issues, but it certainly affects it, and it increases those levels of stress and anxiety, body dysmorphia, eating disorders, way more than any other outlet that they've seen so far. Another study done by the McLean Hospital also shows that same significant increase, that since these younger generations are now having an outlet to something so addictive and something that promotes such unhealthy mechanisms, such as eating disorders so that you can stay skinny, or that doing drugs and substance abuse has become so normalized, it has led to significant increases in mental health issues. So those three main factors put together is why this generation has seen statistically a lot more mental health issues than all other generations combined. And it's really important that we look at the entire picture to see that these these problems are dealt with. And although there are big increase in these mental health problems, it's also important to note that there's also a lot more acceptance of having mental health issues. There's a lot more outlets for people, especially for generational trauma. A lot more people are trying to seek help through therapy, or even they have trauma therapy for those generations to be able to deal with that together and hopefully get to the root of some of those problems so that they're able to unpack it and look at the bigger picture. And hopefully mental health isn't something that can be necessarily cured, but it is something that can be practiced on a lower level. And that's it. If you guys have any questions, you can ask them.
Hi.
Hi.
Okay, my first question is, so a lot of what you said has to do with like patterns and habits, like social media and stuff like that. So how would you recommend breaking those to improve mental health?
So I think that the first way to improve any of these situations is by being educated. A lot of these facts and things that I didn't even know about before, and I've studied mental health issues for like other classes, things like that. So I think the most important thing to do is to educate yourself about the causes of some mental health issues so that you're more aware of it, and hopefully you can try to teach yourself traits so that you're not as addicted to like social media, or like you're taking more care of like your surroundings and things like that.
And then also, so you touched on generational impacts and stuff like that. So how do you think different cultures affect mental health?
So I think that's a really important question. A lot of there's actually a chart on the PowerPoint that I sent you. A lot of these generations, there's different cultures that deal with them differently. So for example, somebody like, I know Hispanic people necessarily aren't as open to mental health issues. So I think it's really important to have like a cultural understanding of like what's appreciated, what's accepted, and then try to have like another base understanding so that you can try and move forward and try and educate older generations who may not be aware of such so that they can learn and be educated, and then hopefully educate their younger generations as well.
Thank you.
Good evening.
Hi.
I have a question. So what do you suggest that a parent should do if they feel that their child or their teenage child or young adult is suffering from any type of mental illness? How could they provide them support? If the child or the teenager or the young adult is not accepting that they have any of these type of mental issues.
So I think, again, like all of the other questions, the first step to any of this would be to educate yourself and to try to come into this topic with an open mind. Obviously, it's a very touchy subject and it affects a lot of people in different ways. So I think the best way, if a parent really wants to help their child, is to educate themselves, and then maybe to realize that since they're obviously a little biased and they may not be the best educated, to try and get their child help, whether that be through therapy, trauma therapy, maybe through different types of like just different types of therapy. I think it's really important for that parent to also have a conversation with their child to see their child needs and how they could better help them as well.
Thank you.
Okay, thank you guys. Have a great rest of your day.
You as well. Bye.